like to thank everyone for joining us this afternoon. As everyone knows, our special guest this afternoon is the Honorable Christine Elliott, Deputy Premier, Minister of Health, and MPP for Newmarket Aurora. We're keenly aware of how busy a time this is for Minister Elliott, as the health portfolio has never been more critical to our province than right now. We appreciate that you're able to spend a half hour with us this afternoon, and so we'll get started. I have a few questions that were submitted ahead of today's session, but if you have a question, I would ask that you please type it into the chat. We'll get to it at the end, time permitting, and if not, we'll make a commitment to get that over to Minister Elliott's office for a response. So I'll turn it over to Minister Elliott right now.
Well, thank you very much, Sandra, for your kind introduction, and good afternoon, everyone. It's a real pleasure to be here with you today. As your local MPP, I appreciate that so many of you wanted to join us this afternoon for this coffee chat and discuss what is top of mind for you and for businesses in Aurora. Over the past year, our local businesses have worked very hard to keep our community safe. I want to extend my deepest appreciation to each and every one of you for rising to the challenge and continuing to do everything that you can to stop the spread of COVID-19. Like many other provinces and jurisdictions, Ontario is in the midst of the third wave of the COVID pandemic. Driven by variants that are much more transmissible, we know that this wave is different and much more difficult to deal with. Key health indicators have continued to worsen, and while we continue to use every resource at our disposal to support our hospitals and maximize our health system capacity, we know that our hospitals are being hit harder than ever before. That's why we have taken action to respond to the ongoing threats to the health and safety of all Ontarians. On the advice of the Chief Medical Officer of Health and with the support of public health experts, our government enacted a province-wide emergency brake shutdown, issued a stay-at-home order, and enhanced our public health and workplace safety measures to further limit mobility and encourage people to stay home as much as possible. As we have seen around the world, measures that limit mobility and discourage gatherings are critical to limiting transmission of the virus and controlling the pandemic. These public health measures will help keep Ontarians at home and stop the spread of the virus so that we can protect hospital capacity and, most importantly, save lives. We know that this news has been difficult for many of you, especially after the sacrifices that many of you have already made to fight this deadly virus. But I do want you to know that there are brighter days ahead. Vaccines are our way out of this pandemic, and Ontario's vaccine rollout is well underway, with over 4.6 million vaccines already having been administered. Locally, many of these vaccines are administered by the team at the South Lake Regional Health Centre, at the Ray Twinney Mass Immunization Clinic, and also by pharmacists at 11 of our local pharmacies. I do want to thank everyone who's been supporting our local vaccination efforts. This is what hope looks like, and our government will continue to work closely with our public health units and healthcare partners to get vaccines in arms as quickly and as safely as possible, pending a stable and reliable supply from the federal government. I encourage everyone to sign up for your vaccination appointment as soon as you are eligible, because these vaccines are truly the best way to protect you and your loved ones from this virus. Now, we know that we can't have a healthy economy without healthy people, and our government will continue to use every resource at our disposal to stop this virus and keep Ontarians safe. Today, the Ontario Legislature passed Ontario's 2021 budget, Ontario's action plan, protecting people's health and our economy. The 2021 budget brings the province's total response to the COVID-19 pandemic to a record $51 billion and brings our total investment to protect people's health and defeat COVID-19 to $16.3 billion. This includes more than $1 billion to support Ontario's COVID-19 vaccine distribution plan and $2.3 billion more in 2021-22 for testing and contact tracing to help make our workplaces, schools, businesses, and communities safer. In addition, we are making key investments to ensure our hospitals have the resources that they need in order to respond to any scenario. Since the start of the pandemic, our government has invested an additional $5.1 billion to support our hospitals. This includes over $1.2 billion to help public hospitals recover from financial pressures created and worsened by COVID-19, as well as additional investments to create more than 3,100 additional hospital beds and expand the province's critical care capacity. We also know that caring for the health and well-being of our communities must involve mental health and addiction supports, because as we all know, mental health is health. As part of our 2021 budget, our government is making record investments in mental health and addiction services, including an additional $175 million this year to enhance and support access to the safe and effective supports that Ontarians need and deserve. Locally, last December, we announced $200,000 to support the planning and development of the New York Region Mental Health and Addictions Crisis Hub to help improve access to mental health and addiction services and supports for individuals and families in York Region. Our government is proud to support innovative projects like this as part of our plan to build a comprehensive and connected mental health and addiction system that offers Ontarians better access to high quality care when and where they need it. In addition to the investments we are making to protect people's health, we are also making critical investments to protect the economy by supporting families, workers, and employers. To help small businesses that have been affected by the necessary public health and workplace safety measures to protect people from COVID-19, we are providing a second round of Ontario's small business support grant payments to eligible recipients. Approximately 120,000 small businesses will automatically benefit from an additional $1.7 billion in relief through this second round of supports. Businesses that qualified for support during the first round will automatically qualify during this round of support and will not need to apply again. I know that this year has been very challenging to many of you, and I want to assure you that our government will be there to help your businesses and our province rebuild and recover from the impacts of the COVID-19 pandemic. Last summer, I had the opportunity to visit many of our local businesses and thank them for inspiring and supporting our community, our frontline workers, and our local nonprofit organizations. I have always said that Aurora has some of the best people and businesses in Ontario, and every day our community shows the world that the Ontario spirit, a spirit of compassion, hard work, and resilience, lives and resides in Aurora. So thank you once again for continuing to do your part to stop the spread of COVID-19 and to keep our communities safe. Together, our collective efforts will get us through the pandemic, and when the time comes, we will rebuild and be stronger than ever before, so that we can continue to say that Ontario, including our wonderful Aurora community, is the best place in Ontario to live, work, and raise a family. So thank you, and I look forward to your questions and our discussion.
Thank you, Minister Elliott. We'll get right into some questions, and if that's all right. Premier Ford recently announced the government is looking at introducing paid sick leave for workers who must quarantine at no cost to businesses. Can you provide more detail on how this program will be implemented and how payments will be made?
Well, this is something that I know Minister McNaughton has been working on with Minister Bethlen Falvey, our Minister of Finance and our Treasury Board President. And we have said that we know that there are gaps with the federal system that is causing some people to not apply, even though they know that the federal program exists. So we are looking at closing those gaps and making sure that anyone who needs help with this that doesn't have sick benefits paid through their employment will be able to access those benefits and not have to worry about those gaps. So further details on that will be coming forward very shortly because we know that people need this support.
Thank you. We applaud the move to bring vaccinations into hotspots, but it appears that more should be done in these areas. As the government continues to prioritize the areas, what is the strategy for going into businesses to immunize? We've had several calls from local medium-sized businesses who are wondering if there will be mobile vaccinations coming to the Aurora businesses.
Yes, thank you very much for the question. We know that we've heard from the medical experts that it's really important in wave two or plan two of our vaccination rollout plan that we should vaccinate based on age and risk and in the hotspots. So we have made a change based on the recommendations of the medical experts to ensure that 25% of all the vaccines that come into Ontario from now on, the first 25% is taken away and allocated strictly to the hotspots. The rest will be divided up amongst the remaining, the 34 public health unit regions. Because it is said that 80% of the transmission and the cases of COVID-19 happen in 20% of the communities. So it's highly recommended that as we do that, it will be to the benefit of everyone in Ontario because we will be able to reduce the transmission that's happening primarily in Peel region and Toronto region, but also some in York region as well. We also know that some people, for a variety of reasons, including the fact that they're working when the vaccines are being done, don't have a chance to get to the vaccine centers. So what we are doing is increasing the pharmacies where the vaccines can be received to being 24/7 operations. And we have an agreement right now with Shoppers Drug Mart to have 20 24/7 pharmacies open, including most of them being in hotspot regions. And we're looking at expanding that as well so that people can receive those vaccines. But we also in the hotspots have pop-up units. We have traveling units. We are going into workspaces where the employers have agreed that they will be able to, they're in hotspots, they will be able to help support the vaccination of not just the people who work for them, but also people in the surrounding community. So that may be people who are family members of the employers, or it may be people who are in other businesses close to those employers. We want to make it as easy as possible for anyone who wants to receive a COVID vaccine to be able to get one. Just in terms of supply, I will say that that has been one of the limiting factors thus far, that we haven't received a really completely reliable supply. We've been working hard with the federal government, and through no fault of theirs, that we know that some of the supplies have been limited, as we saw with Pfizer, as we've seen with Moderna, particularly, and a little bit with AstraZeneca. So we are currently running a pilot program to look at how we can move Pfizer into pharmacies. Mostly they've been supplying AstraZeneca vaccines, and it's been Pfizer in the public vaccination clinics because all their requirements about extreme cold storage for Pfizer, not moving it around too much, the jiggling factor, not having that happen too much, because we want all of these vaccines to be safe and effective. So we're working on that to figure out how that works best to make sure that the pharmacists are all trained on the administration of this vaccine, that they can get 6 doses from each vial, and that we want to make sure that people can go to a variety of locations to receive the vaccines, including Pfizer vaccines in pharmacies.
Thank you. In an article back in February, the Canadian Federation of Independent Business said the average small business owner had accrued $170,000 in debt, and that 17% of businesses were considering bankruptcy or winding down their business. We're now more than a month beyond that article, and we continue to be in a lockdown situation. While we know that health and safety is the top priority, would it not make sense to allow small retail businesses to open safely, allowing only 1 to 2 people at a time into the shop and providing the business owners with some much needed revenue relief?
I know this has been terribly difficult for businesses, particularly small businesses, for over a year. We have done something with the small business grants, something to help people with costs of energy, with property tax payments and others. And we were able to open small businesses under very limited circumstances previously, but right now, as we're into the third wave with these variants of concern, we're not able to do that because we really need to limit mobility as much as possible, and social interactions with people outside of your own family household. We are working very hard to control the spread and to get the numbers down so that our hospitals will be able to cope. We have record numbers of people in intensive care right now. We are building spaces, so we will be able to care for people. But right now, to reopen small businesses, even under very limited circumstances, is not something that has been recommended by our medical advisors. Although I hope that within the next number of weeks, we will be able to go back to where we were and hopefully open up businesses even more so.
Yeah, it has been a very difficult time for them. The Canadian Federation of Independent Business has been lobbying the government to backtrack the Canadian emergency rent subsidy back to the first shutdown for any small business that the landlord did not apply for. Do you have any information on this? I know this is a federal initiative, but I know that it was paid for by both the federal and provincial. And on any information on whether the rent relief will be extended in light of the current lockdown?
I don't. I suspect that MP Van Bynen would probably be the best person to speak to about that.
Okay, thank you. I would like to know why golf courses remain closed. Golf is a sport that one can participate in completely on their own. It is extremely upsetting to drive by playgrounds and see people closely interacting and children playing together on the same piece of equipment, and yet golf courses are closed. I would appreciate knowing the logic behind this.
Well, again, the logic behind this is that we don't want to have people gathering in groups without wearing the necessary protective equipment. And though we encourage people to be outdoors, to be able to go to get some exercise, to walk, to run, to bicycle, whatever, walk your dog. We also know that with golf, sometimes there are people that the partitions have been taken, as I understand, out of the golf carts, that people may carpool together to get there. They may gather together afterwards. And those are the concerns that we have, that this isn't a forever situation. We hope that we will be able to change this in the next few weeks. But for right now, we are really asking people to really limit your mobility as much as you can. Please stay with your own household unit. And that's the best way that we can beat the transmission of this virus and be able to get things back to hopefully a more normal summer for us, for all of us this year. I know this is a really difficult time for everyone to be going through, but it will get better. We are approaching almost 40% of the people of Ontario having had their first dose of the vaccine. We're at 35.8%, and we are on track to be at that 40% mark by the end of April, and then we will move on. We are receiving much larger quantities of the Pfizer vaccine throughout the month of May. We hope to get to over 50% and then onwards afterwards, so that people will be able to move around more, will be able to enjoy a game of golf, play tennis, go out in groups, speak to your friends in the park, and so on. So there is light at the end of the tunnel. I know this is a really difficult time for everybody to go through, but we are getting there. Just another few weeks is going to make a big difference for everyone.
Thank you. The next one's a bit of a crystal ball question. Someone wanted to ask if you feel that we will open on May 21st in gray or red zone.
That one I really can't answer, because it depends on what the numbers are then, in terms of the numbers of cases of COVID, the number of people in our intensive care units, in our hospitals, what the R factor is, sort of the reproductive factor of the virus. It still needs to be well under 1 in order for us to move into a different zone. But I'm sure that if everyone continues to follow the public health rules and physical distancing and wearing a mask and frequent hand washing and staying within your own household unit as much as possible. I know some people do need to go outside to go to work, but for those who can work from home, please continue to do that so that we can make some movement and to opening Ontario up more. But when it happens, I don't have that crystal ball.
Thank you. Um, with the tragic news of the 13-year-old that passed away, is there any new information about treatment or vaccines for young people?
That is a tragic situation. You know, I think all of our hearts go out to this young girl's family, and the death of anyone as a result of COVID is terrible, but it's especially tragic with such a young person. And I know that we all are anxious to find vaccines that work for children and young people. The Pfizer vaccine is available to people 16 years of age and older. And I know Pfizer is doing some trials right now to determine whether it can be administered to people 12 years of age and up. We are still waiting for the results of that, but I think all of us, again, are hoping that it will be usable for young people, because we want everyone in our communities to be protected. Our young people, our adults, and our seniors as well.
Thank you. So the question is, they would love to hear what the metrics are for balanced decision making. Are we listening to both sides of the issue and taking all metrics into consideration when deciding on opening up?
Yes, we are. Of course, we're listening to what all of the medical professionals are providing to us, and we receive that medical information through the science advisory table that primarily does the modeling that helps us predict what our needs are going to be in our hospitals and in our communities. And we also have the preventive health measures table. We have our chief medical officer of health, of course, Dr. Williams, and all of the medical officers of health across the 34 public health unit regions. That's really important because they know their geographic areas best. They know what the specific concerns are in their areas, whether there's vaccine hesitancy, whether there's any socio-demographic issues that we need to be aware of, where the best places are to vaccinate, whether it's multiple vaccination clinics or pharmacies or primary care offices or in clinics. So they know very well. So we are absolutely listening to that information as we make decisions about public health. We're also listening to, we have a jobs and recovery table as well that's taking a look at when we are able to open up more, how do we do it? What's the best way to do it? What are the initiatives that need to be brought forward? What goes, in what way should it happen? In very graduated way? Or do we need to get back more quickly? All of those are considerations that are being thought of by both our cabinet and by caucus. But right now, the primary concern has to be health. And that's what we're focusing our attention on most at this moment.
Thank you. Is there a solution that can be put forward to stop people from booking multiple vaccine appointments, then taking whichever one they like without canceling? The limiting spots available, this becomes a major concern. With limited spots available, sorry, this becomes a major concern.
Well, this does make things more difficult, there's no question, because we want anyone who wants a vaccine to be able to get an appointment to get one. I know that there has been some concern about one of the vaccines, the AstraZeneca vaccine. However, all of the vaccines are safe in Canada. We have taken a look at the AstraZeneca vaccine twice, and we are recommending that it can be used by anyone over 30, although we're staying at age 40 in our clinics for right now until we receive larger supplies of the vaccine. But I had the AstraZeneca vaccine myself. The important thing to remember about all of these vaccines, and the best vaccine to receive, is the one that's available to you, because they will all, even if you get COVID, because not every vaccine is 100%, but they will all help keep you out of hospital and save your life. And I think that's the most important thing that we all need to be concerned about. So if you have an appointment for a vaccine and you're eligible for it, please go and get it. Please do, because that's the best way to protect yourself, your loved ones, and your community.
So true. I know it's 3:30, right on the dot. We don't have any other questions right now. Um, Thank you very much for joining us today, Minister Elliott. I know how busy you are these days and how hard it is for you to take time out. So we really are very appreciative that you've joined us today.
Thank you. It's been my pleasure, Sandra. And thank you to so many people from Aurora who have called in to listen to this.
Yeah.
I'm very
Thank you.
grateful. Thank you very much.
Thank you very much.